Hello everybody, this is Dr. Kukreja A Kalani and I'm here to speak about phobias. So as the name suggests, it means an intense fear, a reaction which is not proportionate to the trigger factor or a stimuli. So a patient overreacts to a situation and he develops a feeling of uncertainty and wants to escape that complete environment or a situation, and this leads to the disruption of a normal life. So it leads to social isolation. It can also lead to mood disorders. And so it's very important to, identify why the patient is behaving in such a manner and how to treat it. So a very common therapy is what we call as a psychotherapy, where there's an exposure therapy, where we try and identify the patient's, vulnerability to overreact because of his sensitive nature. Secondly, it is CBT, so what we call about therapy, where we check upon the patient's negative thinking patterns and we try and amend it. Apart from there is help with medicines also available. Now, who are at a higher risk to develop such phobias? First of all, we'll find out that the age group. So whenever the child is, say, a person is below 10 years of age, he can develop fear about darkness or exams, but over a period of time, they overgrow this fear. But there are various fears which can happen at any age. Secondly, is a blood relative, or say genetically you are more vulnerable to certain anxiety, so it can also be found run in families. And if you have seen or witnessed a certain sort of fear in your parent, witness the whole episode, so sometimes you identify with that condition and you actually develop that type of thinking and that fear. Then who are more vulnerable? People who are sensitive, so are emotionally or physically very sensitive to impressions, are no more predisposed to develop such type of fears. What are the different ways of handling? We already discussed. There's psychotherapy, there's CBT and medicines. Apart from that, it's very important that we should not allow the disease to linger. Disease meaning when the patient is not at ease, that's what is called as a dis-ease. And that's why we need to diagnose the problem very quickly, identify it and treat it, so that the patient does not get into social isolation or any other complication.